to interview our group, Rashmi, Sindhu, and Pushpa. Today we are going to talk about the dynamic strategy and disruptive innovation of FutureMed. I would like to start with the meaning of disruption. Actually, the first feeling of the people, the owner of the business, when they heard this word, they are fear and worry about. But this word is mean change. Disruption is a change that change in a new way. So if we combine with the internal, external, marketing and technology perspective together, that can help the company to get the new different of the service and product for customer need and achieve the goal. Disruptive innovation strategy by internal perspective, external perspective, marketing perspective, and technology perspective. So I would like to start with the internal perspective. The first one, the human resource. For the corporate level, is required to be in charge of the centering problem development idea was more actualizing them. But the other hand, for the senior manager, that they have been trained in a conventional business program that may not get the disruptive innovation work. For the FutureMed structure, it is possible to detect that the board expect the management team be aware to new innovation, but however, don't have support to focus in identify them. The company just have meeting between head manager that work in the new project to evaluating the potential to create the profit for the company. The recommended the company should have a special team that can work for create the business opportunity for get more profit. And also it's always to include in the management team manager that has wide vision. And next to the organization culture, disruptive innovation can be followed by big change in the process inside of the company. And for this the result, the management team needs to be flexible to adapt to the new change. For the survey in this company, that staff on average demonstrate a high resistance to change, creating a conservative culture in the company. So that to achieve the company goal, also create a business that can go and follow the market. The company should change this vision and implement in the company a flexible way to read with the change. And the last one, the resource allocation. The resource allocation that have budgetary return as the key. As the key factor can facilitate the improvement of this disruptive innovation. The FutureMed had meeting often to discuss about the project, and also each sector had a different goal and vision about the business, what can make the process slow in a decision make. So the best way to do this point that they have to get the special sector with own budget to act in behavior of the company. And when this the sector, and then when this the sector has power to make the decision to improvement would happen in a fast and efficient way. And part two, Lakshmi to talk about the external perspective.
That we are going to talk about is external perspective that we talks mainly in three domains, that is regulations, relationships, and economic conditions. About the regulations, the major problem of FutureMed is getting registered in ARTG, that is Australian Register for Therapeutic Goods. So that we analyzed that the hindrance that FutureMed is facing right now is getting registration, which is affecting the company to advertise or sell its pharmaceutical or to sell its radiopharmaceutical drugs. The recommendation we give to FutureMed is that FutureMed can focus in other countries like Indonesia and New Zealand rather than in only Australia, where it has many chances for its marketing and its development. The next domain is the relationship, that is shareholders expect high returns, and analyzing this domain, we found out that the company is paying its shareholders high dividends, and shareholders have developed an expectation of better than average returns as a result, whether it's long term or short term. If a company does not have any strategy for innovations, it's obvious that the company will soon crash in the future. So we recommend that the shareholders should take more risk and attention in creating innovative ideas or innovations for the company. And before making any commitments, FutureMed should assess its potential impact on its innovative ideas or in any innovations. The third domain is the economic condition, that is difficulty in raising money for the product in Australia, that is FutureMed is facing right now. So we analyzed that difficulty to raise capital to fund the development of new pharmaceuticals in Australia as it is still developing science which is understood by few business financiers and feel comfortable with. Is inadequate financial support for new technology and disruptive ideas and developments. Its culture does not encourage any entrepreneurships to its workers or any other members of the company. So we recommend that FutureMed should find another place to introduce instead in Australia. Instead of introducing the product in Australia, FutureMed can go to Indonesia and New Zealand where the company is recognized for its new technology and its advancements, and where the country is very open to new developments and new ideas. So for the next perspective, I'm going to call my friend Sindhu. Thank you.
Talking about marketing perspective, starting with marketing. Marketing is a process through which goods and other services are moved from concept to the customer. It includes identification of the product, determination of the price of the product, distribution of the product, and then developmental and implementation of promotional strategies. Along with the internal, external, and technological perspective, marketing perspective also has a high impact on the organization's capacity to innovate. Traditional means of marketing, which is used by FutureMed, offers a high opportunity for the rival companies to move ahead of the FutureMed. To minimize or negotiate these chances of rivalry in the business, FutureMed pharmaceuticals must innovate and pay attention to consumers, identifying and delivering exactly what the consumer wants. The marketing perspective examines and explains the way in which companies can accelerate their competitive advantage and seeks for emerging market areas where companies can grow in future. Marketing perspective mainly focus on three main points: customer base, empathetic design, and led user process. Customer base means the marketing should be completely focused on customers. That means reduction in cost, promoting customer-centric products, and enhancement of post-purchase service quality. On analysis of FutureMed company, we found out that in FutureMed, only one area of the company, that is research and development department, is allowed for marketing research. So this means this area is only restricted to do research, whereas other areas remain silent. So recommendations for customer base includes FutureMed should involve other departments like sales and marketing department, manufacturing department in market research. Then members of the cross-functional team of FutureMed should visit the customers to get customers' insight about the product. Next is empathetic design. Empathetic design helps the company to identify the customer's feeling toward a product and tries to meet users' need. On analysis of the company, we found out that research and development department has the limited understanding of what doctors and physicians actually need. That means research and development department is not doing proper survey and not collecting the adequate feedback and response from the customers, and is devoid of knowledge and information about the technological advancement which is made in medicines, which the physicians and doctors look for. Therefore, the recommendations made on this point are use of empathetic design. That means the company should focus on finding out feeling of customers towards the product and tries to meet the demand of the product. Then the company should conduct surveys and collect data and feedbacks on the product, and the company should also receive and implement advices of doctors and physicians in manufacturing and promoting better medications. Last is lead user process. Lead user are the first person who use the product which is produced by the company or the services offered by the company and identifies the areas of development. On analysis of the company, we found out that market research involves companies target market doctors and physicians only, whereas all other people remain silent. FutureMed does not involve and gather information from lead users. So we recommend the company that the company should formulate an embedded lead user groups, which means the company should formulate a group of employee who first utilize the product and give feedback on that product, and then one-to-one talk with the customer who are using the product and identifying the limitations of the product. Last, finding out the need in new market for the product or services. For talking about next perspective, I'd like to call Pushpa.
Talk about technological perspective of FutureMed. On the basis of our analysis, we found that there is lack of vigilance, update and attention to the disruptive technology opportunity within the company. Similarly, they have not adopted any systematic approach for the use of any disruptive technologies. And also, there is no evidence of identification of disruptive technology opportunity and use of advanced technology. Now, I'm going to talk about innovation capacity of the FutureMed. For the innovation, they have to first assess the need of the market demand. Doctors and physicians are the primary target customers for the company. They are the main users of the nuclear medicine during their treatment procedure. The company must meet the need of their most demanding customers. Similarly, the hybrid nuclear modality. The company can direct itself to manufacture the product which can be used in further develop and exploit hybrid nuclear technology, as this product provide more accurate diagnosis and treatment, and the market value of the product will increase. And also, the companies should transfer technological discovery from the laboratory to the clinic. For this, the company have to give more emphasis in the use of its product. Similarly, reliable and secure access should be made available for the distribution of the medicine to the target customers, and use of the associated technology to produce radioactive medicine for the treatment of life-threatening diseases such as cancer, neurological diseases and cardiovascular diseases. For the betterment of the company, we have made few recommendations. The molecular imaging and nuclear medicine serve a vital purpose in the patient care, and both current and potential utilization are growing. The company should be flexible and collaborative enough to increase its market. Similarly, it should increase the production of the medicines, which automatically lower the cost and increases its availability in the market. Similarly, the company should make improvement in the detector technology, image construction algorithm and advanced data processing technology. Now, on the basis of analysis and research, we concluded that the company FutureMed is very poor at practicing disruptive innovation strategy. Its internal, external, marketing and technological perspective are lacking to meet the demand of radiopharmaceuticals in the field of medicine.